It's Dr. Trudy Ufondu of Snowspirations and another opportunity to have our weekend word round. So thank you so much and welcome to Snowspirations Global Health Solutions. It's Saturday, and guess what? Today is the very last day of the month. By this time tomorrow, we'll be in a fresh month of August. Now, the month of August is a very important month to me. My wife's birthday is on this very month we are going into. So it's very important we start on a very good note. And there are so many beautiful things that also happen in August. August is the countdown to the last quarter of the year. Now, this afternoon, you will have an opportunity to get feedbacks from me. So it's open clinic. So open clinic concept is very simple. I'm gonna sit back and I'm gonna take care of all your questions and your concerns. Then you're gonna go back and you're gonna review. Now, if the month of July was not your month, it's okay. If God wants to bless you in the month of July, God would have blessed you by now. Some people are going to be blessed in the month of August. But here's the deal. Have you done everything right? Have you prayed? What kind of prayer are you saying? Have you been playing? Have you been meeting with your partner 48 hourly? Have you been practicing? Do you have a fertility specialist? Or are you just staying in the same spot? You see, it's very easy to be comfortable in your infertility. It's very easy to be lost in the emotions and the sentiments. Now, let's face facts. If you want to be a mother and you're not a mother, it's very stressful. It will cause a lot of anxiety. It will cause a lot of strain in your relationship. Some people can lose sleep. Some people can lose confidence. Some people can lose their libido. Some people might not even find comfort or joy in things that used to make them happy. Now, the essence of infertility, it's very simple: to make you sad, to make you depressed, to make you completely query your existence. But here is the deal. If God brought you this far, God brought you this far for a purpose. If you are desiring to be a mother, you will be a mother. If you're desiring to be a father, you will be a father in the month of August. In 2022, we are going to have so many new mothers, so many new fathers. It will happen. You will be in the list. Now, what I want you to do as your reality check, for the 31 days of July, I want, guys, for the 31 days of July, I want you to ask yourself simple questions. Have you done everything right? Have you prayed the right way? Have you made love 48 hourly? Do you have a fertility specialist? If you have checked all these boxes, then you're practicing the PPP. This is our motto. This is what will make you a mother. This is what will make you a father. As we are going into a new month of August, tomorrow, I want you to renew your objectives. I want you to check your goals again. I want you to review. If you've done everything right and you didn't get results in July, it's okay. Go back to the drawing board. Keep on keeping on. Don't give up the fight. Until you become a mother, it's not over. Until you become a father, it's not over. So that's a way of my opening statement. This afternoon, please, I want you to follow me. I'm Dr. Ndiche in the clinic as I talk, so we can help you to provide feedbacks. Now, please, as you're going into August, make sure you equip yourself with the knowledge you need. So knowledge is important. If you are lacking knowledge, please acquire the knowledge you need. If you need to come in for one-on-one consultation, please consider signing for packages. There are 1 week package that can help you. There are 1 month package that can help you. There are 3 months package that can help you. There are 6 months package that can help you. If you are already pregnant, please don't go alone. I want you to give us the opportunity to walk the walk with you. So work the first trimester, work the second trimester, work the third trimester, so that at the end of the 9 months, you will become a mother exactly how God wants you to become. So please don't walk alone. We want you to have your baby. We want you to have your girls. We want you to have your boys. And we want you to be happy. You're not just going to have one baby. You're going to have all the babies that God wants to give you, right? So if you want to have 2 babies, you can have 2 babies. If you want to have 3 babies, you can have 3 babies. If you want to have 5 babies, you can have 5 babies. On this note, I also want to congratulate and actually give a kudos to our brothers in Morocco. If you don't know, in May, doctors in Morocco were able to deliver a woman from Mali of 9 babies, 5 girls and 4 boys. In Mali, in Morocco, not in America, not in Australia, not in Britain. So whatever you need is provided for you. If God says you're going to be a multiple pregnant mother, don't delay that prophecy. Don't delay that dream. Make yourself available. Yield and seek higher knowledge. So thank you so much for sticking with SGHS for the whole of 2021, from January up to July. God is going to do amazing things for the month of August. Nothing can stop us. So the clinic is going to open now. I want you to focus on the admin. So admin is going to give you the directives you need to have so you can get help. We are live in 3 different platforms: YouTube, our page, and our group. So whichever one you choose, please go ahead and start asking your questions. So the clinic is open now, and I'm ready to take care of your questions. So please go ahead and start asking your questions. Dr. Ndiche is also in the clinic. Dr. Ndiche is also going to help to attend to your questions. The ones I can provide feedbacks on, she will provide the feedbacks on them. But right now, please go ahead and start asking your questions. It's open clinic. There is no particular topic I'm discussing today. I'm just going to sit back and give you feedbacks. So feel free to ask your questions. Okay? So if you haven't joined our group, click on the link. You need to be in the group. You need to be in the page. Then you need to be on our YouTube. If you're on Instagram, you can also find us on Instagram. But right now, I'm ready to take care of your questions. So please go ahead and ask your questions. Please ask your questions. The clinic is open, and I'm waiting for your questions. So if you have questions, please go ahead and ask, and I'll provide you feedback. Do you have questions? Do you understand your body? Do you understand your role? Can you exactly say for sure you've been doing the right things? If you can say you've been doing the right things, then you're in the right place. Don't worry about nothing. Be positive. Confess positively. Be mindful the group you belong to. You know, so many women are so comfortable now. Sometimes you might not even know you're comfortable in your infertility. There are some women in our believing for baby category. They are not doing the right things, but they are hoping they are pregnant. Now, my people, you cannot become pregnant in a vacuum. It doesn't happen. You cannot become pregnant because you're dreaming about it. It doesn't happen. You will become pregnant by playing, by praying, and by practicing. This is how to become pregnant. And I want you to especially consider your ways. If your ways are not yielding results, then change your ways. If you have been following us religiously, I don't see any reason why you can't be a mother in 2022. There are so many ways you can be a mother. Now, also accept your fate. If you are having a particular infertility challenge, don't say you bind and cast. It's not your portion. Binding and casting, claiming, doing whatever, it is not going to make it real. What will make it real is when you act. So when you say you bind and cast, when you say infertility is not your portion, then you need to do the right things. Just by saying infertility is not your portion and you're not doing the right thing, it's not going to get you pregnant. But when you pray and say infertility is not your portion, you meet your partner, you see a fertility specialist, then God is going to meet you halfway. Our God has already made you a mother. Our God has already known the number of babies you're going to have. But sometimes we delay ourselves because of our unbelief, because of our attitude, because of our practices, because of the people we hang around with. If the people you're hanging around with today, if they are the reason why you're not a mother, consider stopping hanging around them. Your tribe will determine your vibe. Your vibe will determine your tribe. Make sure that the group you belong to are positively minded group. Groups that will remind you you're a mother. Groups that will tell you your truth. Groups that will never lie to you. Groups that will support you in the good days and in the bad days. Very important. But right now, please go ahead and ask your questions. The clinic is open. So regardless of your diagnosis, don't stop your PPP. The first one is praying. The second one is playing, 48 hourly. Meet with your partner. The third one is what? Practicing. So practicing means everything I've been teaching you, the seminars you've been attending, the master classes, the consults, every single thing I've been teaching you, when you put them into practice, you're going to be a mother. You're going to be a father. Okay, so guys, do we have anybody that has a question? Do you have anything you need to clarify? Have you been sending me messages and you're not getting feedbacks? This is an opportunity for you. If you cannot afford the services, open clinic, word round, it's an opportunity for you to get feedbacks. There are no assumptions in this game. The only way you can get help is to acquire the knowledge you need so you can become who God said you will become. So please go ahead and ask your question. Okay, so the first question says, please, since you got pregnant, you don't feel like having sex anymore. Even if your husband touches you, you don't feel like it. Please, is there any solution? Because you're afraid it will affect your marriage. So here's the deal. The fact you're pregnant doesn't mean you should stop, so long as you don't have any medical issues. But here's the deal. Pregnancy can affect women differently, especially their libido. There are some pregnant women that will have increase in their libido during pregnancy. Then there are some pregnant women that will have decrease in their libido. So it's an individual thing. It's also dependent on how pregnancy is affecting you. Pregnancy can change a lot of things about you, and you can change a lot of things about pregnancy, including your health, including your sexual part. Now, what you need to do is to have meaningful conversations. If your pregnancy is going smoothly, if you are attending your ANC, if your doctor didn't tell you not to make love, and you're okay, and your libido is still a problem, then have a meaningful conversation with your partner. It's important you don't neglect the needs of your partner simply because you want to become pregnant or simply because you're pregnant. This is why nature abhors vacuum. When you create a space between you and your partner, and if it's not justified, it might be a room for your partner to look for excuses, to look for reasons. So it's important you have meaningful conversation with your partner. You see, when you are in a relationship, there are times things will change. There are some families that when the babies enter, everything changes. Every singular thing. Some people are hoping to become parents. By the time you're a parent, so many things will not be the same. So many things, including your sex life. So the earlier you have a meaningful discussion, the better. So what I will suggest for you, my sister, you have to meet with your partner. You have to listen to your partner's needs. You have to find how he feels. If both of you are on the same page, there are so many other avenues you can find to make sure you're still playing your matrimonial role. But if you work on assumptions because you don't want and you don't feel how your other partner is feeling, then it might be a problem. Your partner might actually have a need, and some people are not good in communicating their needs. So it's an aspect we have to address. But remember, pregnancy can affect you differently. Some women will want more, and some women will want nothing. So long as you are okay, so long as we don't have any medical reason, then you are allowed, even if you want to eat it like food. It's for good. Matter of fact, when you indulge in intimacy in your pregnancy, it creates a lot of bonding. It creates a lot of affection because pregnancy can change a lot of things. Some pregnancies can be very stressful. So you need to know how to meet each other halfway. Okay. So you need to meet with your partner and make sure your partner is in a good place. So guys, ask your questions. Ask your question. That particular question I actually love. So if you have questions, this is an opportunity. In the next 15 minutes, I'm going to provide you feedbacks. So please ask your questions. From tomorrow, August 1st, we are going to reload. We are going to keep going. There are so many people that will become pregnant in August. There are so many people that will be on their way to twins, triplets, quadruplets. It's going to happen in this group. God hasn't finished with us yet. So please equip yourself with the right knowledge. Change your attitude. Begin to practice better. Change your perception, and you will become. If you have any need to get help, if you need to be referred, if you are planning to go for IVF, if you are planning to go for IUI, it's important you go with the right thing. It's important you acquire the right knowledge. It's important you prioritize. Please don't go alone. Go with people that can help you. If you have the advantage of being in Nigeria, we can refer you to a caring, compassionate, experienced, evidence-based fertility specialist. You do not want to go to a place where they will take your money and nobody will explain anything for you. You need to go easy. We need to find stepwise approach to your issues, okay? But guys, ask your questions in real time and I'll provide you feedbacks. If you missed any of the master classes, you can get the PDF. The PDF of this month's event will come out very soon. When it comes out, make sure you grab a copy, especially if you're planning to go for IVF. You do not want to miss a copy of our symposium. It was fully loaded. Okay, so guys, do you still have questions? Okay, here we go. Let's see. When are the best time to get pregnant? I believe you're asking about getting pregnant after miscarriage, right? So here's the deal. Miscarriage is a very unfortunate thing to happen to any mother. So miscarriage is just like a thief in the night. Suddenly you're pregnant. Before you blink, you're no longer pregnant. Miscarriage is the unintended loss of your pregnancy before 20 weeks. When you lose your pregnancy beyond 20 weeks, it's called stillbirth. So this is what we need to do. When you have miscarriage, it's very painful. There are different forms of miscarriage. You can take the form of what we call missed abortion. So you probably lost the pregnancy, but there was no sign, there was no bleeding, there was no pain, but the pregnancy is not viable. Some people can have chemical pregnancy. Some people can have blackhead ovum. Some people can have molar pregnancy. They are all forms of modified miscarriages. Now, here's the deal. Majority of the miscarriages you're having are just the way of the body protecting itself. Your body wants to give you the best. So most miscarriages are caused by what we call chromosomal abnormalities. Chromosomal abnormalities means when the baby is forming, there are some errors and our body wants the best. And the body has to expel that particular baby because that particular baby is not the best. Now, this is what happens in most miscarriages. But this is what you need to do. When you experience miscarriage, while you're crying, while you're feeling bad, call your doctor. When you call your doctor, book an appointment, go to the clinic. Let your doctor examine you. We're going to ask you questions. We're going to examine you. We're going to likely have an ultrasound. If it's confirmed you've had miscarriage, we're going to cancel you. If we need to allow you to expel the remaining part of your baby by yourself, you can expel it by yourself. Some people, we can give them some drugs to help in expelling part of the baby. Or some people, we can go for evacuation. Now, when we've done all this and you've stopped bleeding and you're recovered, we have to investigate. This is an area that so many women are not doing right. So many women are quick to go and try to become pregnant again. Meanwhile, we haven't discovered what might have caused miscarriage in the first place. There are a couple of things that we can prevent, that can prevent miscarriages. If you have infection, we can treat that. If you have hormone imbalance, we can treat that. If you have cervical incompetence, we can treat that. But the ones we can't treat, nobody can control that. The fact you had miscarriage in one pregnancy doesn't mean you can't become pregnant in the future. But if the reason why you had miscarriage was not addressed, then you will continually keep having miscarriages. So if you have cervical incompetence, that means your cervix is not strong enough to support your baby. If we don't identify you have cervical incompetence and you become pregnant again, you're going to lose the pregnancy. But if we discover you have cervical incompetence, we can give you cervical sacrilege. Then subsequent pregnancies, you can carry your baby. If we discover you have infection, we can fix the infection. There are some infections that can lead to miscarriage. If you have hormonal imbalance, like some people might have low progesterone, we can supplement your pregnancy. So when you've had miscarriage, it's painful. But at the end of the day, you have to go back to your doctor. We need to investigate. This is what you need to do. So before you begin to plan to become pregnant again, make sure you go to your doctor. Make sure we confirm you're good to go. Don't try to become pregnant immediately. Some women, we can ask them to wait for 3 months. Some we can even ask them to wait for 6 months. Some we can just tell them, you know what? Once your period comes back, start trying. It's individualized. Very, very important question. I love that question. Okay, guys, let's quickly knock off some other questions so we can all go, okay? Okay, what do we have? Please help you. You are not ovulating. They gave you letrozole and progesterone injections. Still, you are not ovulating. Now, my sister, personally, whether you're ovulating or not is not my concern now. My concern is who is taking care of you. You see, becoming pregnant is not just all about you. So it's not just all about ovulation or not ovulation. You and your partner needs to be investigated. The two medications they gave you, if the two medications correctly fix your ovulation and you are ovulating confirmed, then you're going to become pregnant. But when you're taking care of only the woman without looking at the man, you are solving just 50% of the problem. What about the man? So you need to have an overview from a fertility specialist. Now, you can decide to be sentimental. You can decide to be crying. If you don't seek help, you will notice that by December, you will still be crying. So what you need is not to cry. You've cried enough. Make sure you have a good fertility specialist who will identify what the problem is. The moment we identify the problem, then we can begin to find solutions. But if it's a blind thing, we assume, oh, is this, we go here. You keep moving from pillar to post. Unfortunately, any doctor can give you any drug. Any doctor can claim to be a fertility specialist. But there are some specially trained doctors who had experience in helping people that have problems. Those are the doctors you need. So, and my sister, the only way to confirm if you're ovulating or not is not to check yourself for cervical mucus. It's not for pain. It's to go to a gynecologist. There are some specific tests we have to run to confirm if you're ovulating or not. Until we've confirmed that, you cannot say for sure whether you're ovulating or not. So it's possible you're ovulating, but you think you're not ovulating. So you need to be mindful. Crying is okay, but when you're crying without a purpose, then it defeats the aim. Okay? So you need help. And the best help you can get is from who? A fertility specialist. Okay, guys, keep asking your questions. Let's see what we have. Doc, you're 34 weeks pregnant and lately your abdomen aches downward. What's the cause? First of all, my sister, you're supposed to be in our ANC lounge. Now, anytime you're pregnant, anytime you have pain in your pregnancy is not a good thing. So pain is not normal. Now, you can have little dull ache, discomfort here and there. That's okay. But if you notice pain in any part of your belly in your pregnancy, you must report to your doctor. It's not a guesswork. And my sister, you're 34 weeks. So at 34 weeks, if anything happens to this, your baby right now, and we decide to deliver your baby will be fine. What we are going to do for your baby is to give your baby what we call surfactants. Because at 34 weeks, it's expected that your baby's lung is about to start maturing. The biggest organ in the body of a baby that will help the baby to survive outside your body is the lungs. So at 34 weeks, if your baby decides to come before 37 weeks, which is premature delivery, then we can deliver your baby. Your baby will be in the NICU for few weeks. Then you will go home. Now, if you have any complaint in your pregnancy, it's not something you sit back and you begin to run from one place to the other. You ask your ANC doctor. There are signs in your pregnancy that once you have them, you begin to be worried. Pain is number one. Bleeding is number two. Water coming out of your body. So these three things. Anytime in your pregnancy, you are experiencing pain, you are experiencing bleeding, you are experiencing leakage of water from your body, it's possible you are about to have miscarriage or stillbirth. Now you're 34 weeks, so you need to be careful. Your appointments for your ANC is now more frequent, especially depending on your age. So what I will tell you, bring your ANC doctor. If you haven't joined our group, admin will help you to join our ANC group. Unfortunately, some women are just interested in becoming pregnant. When they are pregnant, they run away. Then when they start having complications, they come back. We want to help you to become pregnant. Admin, capture this for me. help you to go through your first trimester. We want to help you to go through your second trimester. We want to help you to go through smooth labor. Then we want to help you to have good delivery. Then we want to help you to start breastfeeding your baby. This is what we do. It's a continuum. Your journey doesn't just end by becoming pregnant. Unfortunately, some women want to become pregnant. When they become pregnant, they don't heed to my advice. They disappear. They don't register for their ANC on time. They begin to have complications. The moment you begin to bleed and you didn't go to the doctor and you are waiting to report to me in my inbox, meanwhile you're not a subscriber, it is late. Once you notice you are bleeding, you are calling your doctor immediately. There is nothing to wait for. Bleeding in pregnancy, admin, capture this for me. Bleeding in pregnancy is a danger sign. It is not normal to bleed. You cannot have your bleeding when you're pregnant. So you can't have your menses when you are pregnant. When you are pregnant, your menses will stop. That's exactly the way the body is structured. So anytime in your pregnancy, you went to wee, you wiped, and you saw tiny blood, is a danger sign. You are calling your doctor. You are heading to your doctor. We are doing everything possible to save you and your baby. Now, this is another thing you need to practice. Anytime in your pregnancy you notice bleeding, observe these 3 S's. No sex, no sports, and no stress. No sex, no sports, and no X. Admin, capture this for me. Anytime in your pregnancy you notice any form of bleeding, is a danger sign. All forms of bleeding in pregnancy is considered abnormal bleeding. There is no normal bleeding in pregnancy. The only time we can rule out implantation bleeding is when you presented yourself to the doctor. Very, very, very important. Okay? All right. Let's see. Can you do IVF if you're not seeing your period? Yes. Very, very simple question. So whether you're seeing your period or you're not seeing your period, some women might not be seeing their period, but they are ovulating. The criteria for going for IVF is the availability of quality eggs. When we check your eggs, so long as you have quality eggs, whether you're bleeding or not, you are a candidate for IVF. So what we are interested in is not the physical manifestation. So most times you see women, doc, I'm not bleeding, doctor, I'm not bleeding. But in as much as we are worried about the fact that you're not bleeding, we are more interested in the content inside. So long as you have eggs, so long as you haven't exhausted your eggs, whether you're bleeding or not, you can still go for IVF and you can get results, okay? So bleeding or not bleeding should not be a disqualifying criteria for IVF. Okay, so let's continue, guys. Let's actually wrap up. Great job, Dr. Ndiche. Okay, guys, ask your questions. Okay, let's see. Okay? During you're trying to get pregnant, can you continue to take folic acid or pregnant care for conception? So here's what you need to do. If you are already taking pregnant care, folic acid is contained in your pregnant care. That's all you need. You don't need to take any extra folic acid. Your pregnant care is fortified with multivitamins, not just folic acid. So once you have your pregnant care, read the label. So long as it has 400 to 600 micrograms of folic acid, you don't need extra folic acid. You just need to start taking it, especially 3 months before pregnancy and 3 months into your pregnancy. So that period of 6 months, it's very important. Why is it important you need to take your folic acid? Because folic acid will help in proper development of a special area in your baby's brain called the spinal cord. Together, they are called the neural tubes. Your baby's brain, the spinal cord, and other supportive mechanisms for your neurological system. When you take adequate level of folic acid, which will fortify what you're not getting from your food, you will be sure that your baby will not develop neural tube disorders. Top on the list is what we call spinal bifida. So you must take your folic acid, which is contained in pregnant care. Matter of fact, what I preach, what I suggest, what I recommend, so long as you are making love without protection, start taking your prenatal multivitamins. Do you know why? Admin, capture this for me. Most people will not know when they become pregnant. And remember, you're supposed to start taking your prenatal multivitamins 3 months. So some people can be making love without protection. And some women will not even know they're pregnant until they've gone into their second trimester. So you don't want to expose your baby to danger because of your lifestyle. So long as you are a woman right now, you are making love without protection, please go to the nearest good pharmaceutical shop, get your pregnancy prenatal multivitamin, start taking it 1 daily. It's not going to affect your fertility, but it's going to protect your baby when you eventually become pregnant. Okay, so guys, do you still have questions? If you still have questions, please go ahead and ask so I can wrap up. My time is up. Yes, 400 to 600 microgram. 400 to 600 microgram. Microgram, not milligram. So long as you have it in this range, you're good to go. The popular one in Nigeria is Pregnacare, but it mustn't be Pregnacare. There are so many other good ones. So if you're in America, go to Walmart, go to CVS, go to Walgreens, whichever one they have there, check the expiring date, make sure you have adequate level of folic acid, then start taking them religiously. Don't make the mistakes of not taking them religiously. You have to take them as if your life depends on it, because truly your life depends on it. So you have to take them religiously. Okay, so let me quickly go up. Then we are going to have a wrap. So I believe we've attended to everybody's question. Okay, this person is asking, can you bring your donor if you can't provide the money? Now, here's the deal. You know, when we talk about donor X and donor sperm, some people think you just go to the street and you drag whoever you see there and the person becomes your donor. That's not how it works, my sister. There are criteria that must be met before someone can be a donor. Number one, the person has to be young. The person has to have good health indices. We have to confirm that the person is good. We have to confirm that the person doesn't have medical problems. We have to confirm the person's lifestyle. Then we have to confirm the fact that the person has good eggs. So you don't just go and bring anybody because you don't have money, then you say this person is going to be your donor. We have to analyze, we have to assess and make sure that the person is qualified. So donor eggs, donor sperm is a very, very careful process. Okay? All right, let's continue, guys. Let's actually wrap up. Okay. Can your fallopian tube be blocked and you are ovulating? Your fallopian tube and your ovulation, they are not connected. They are like night and day. So your tubes can be blocked when you're ovulating, and you can be ovulating and your tubes are blocked. Now, the most important thing is that you are ovulating. So long as you're ovulating, if your tubes are damaged, you can go for IVF. But if you're not ovulating, that's where the problem starts. So if I'm to choose a problem a woman will have, it's better to have a blocked tube than not to ovulate. Admin, capture this for me. It's better to have a blocked tube than not to ovulate, because when you don't ovulate, you don't have eggs. And when you don't have eggs, you need donor eggs. So a woman that is ovulating, but her tubes are blocked, can go for IVF, and you can have twins, and you can have triplets. But if you are not ovulating, there is no egg to use. Does it make sense? So if there is a particular challenge to have, it's better to have blocked tubes, and we can still use your eggs, and you can still become pregnant, than to have all your tubes open and everything normal, but you don't have eggs. Unfortunately, as you're getting older, your eggs are depreciating in number and quality. So you need to act on time. This is what we've been preaching in this group. Age is very important. So many women are going to enter menopause by end of this month. So many women are going to enter menopause by December. So many women might just have 4 eggs remaining. So many women might just have this year to become pregnant with their own eggs. Now, the question I'm going to ask you, and I'm not saying this to make you feel bad. I'm asking you a genuine question, my sister. What is your game plan? My brother, what is your game plan about 2022? How can you become a father? Admin, capture this for me, please. Put in a very big canvas for the month of August. How can you become pregnant in the month of August? How can you become a father in 2022? What can you change about your approach to infertility? What is your knowledge base? What are your practices? What are your perceptions? What is your attitude? Do you understand why you don't have a baby today? Have they given you your diagnosis? Is it male factor infertility? Is it female factor infertility? Are you seeking the right kind of help? Or are you just praying? If you can provide answers to these questions, you can become a mother in 2022. Now, understand that at any age, you can become a mother. At any age, including age 100. Now, how you become a mother at age 100 is not how you become a mother at age 20. At age 100, you can adopt. That's your baby. When you adopt your baby, it's your 100% baby. When you're in your 20s, you make love naturally and you become pregnant. If you are 60, you can still adopt, and some people can go for donor egg, and they can go for surrogacy, and they can still become mother. There is no difference between natural conception, IVF, IUI, surrogacy, adoption. They are all the same. So whichever one exposed to you, please go for it. Now, I also want to caution you. So many people recently got bad report from their IVF. You spent millions. Listen to me, you know yourselves. In as much as I'm so down that you didn't succeed, I don't want you to make the mistakes you've been making. When your IVF fails, one of the things you must have as a conversation with your provider is what? A comprehensive report. Most providers will quickly tell you, oh, we're going to give you 50%. We're going to go for another cycle. Refuse to go for another cycle if they have not explained to you what happened. Please don't spend 2 million and it failed. And next week they tell you to come back to continue. No, completely not applicable. We need to know why. We need to review. We need to see what we can do differently. Don't make the mistakes of rushing back. When you rush back, what happened in the first one can repeat itself and you will be in pain in the same time. I don't want you to cry again. The only time I want you to cry is when your baby comes. Let me tell you the frank truth. A baby changes everything. No matter how tough your world is, when you remember that your baby is dependent on you, even if you don't have money, even when you're hungry, God has a way of providing for your family. No matter what you have achieved in life, no matter how much money you have, no matter how many cars you have, no matter how big your house is, if you want to be a mother, if you want to be a father, but you haven't become, then you need to change your ways, because the only thing that will make you complete and happy is to become. And if you're not becoming today, you need help. There is nothing to pretend about it. When you need help, you say you need help, then you get help. And when help is offered to you, you act on time. So many women are wasting time. You cannot afford to waste time in the month of August. You cannot. You have to change your ways. You cannot keep doing what you've been doing in the past and you're not getting results and you're planning to do it again. My sister, it's not applicable in our group. You can also become a mother. I've been captured this for me. You can also become a father. You can become a mother of twins. You can become a mother of triplets. You can become a mother of quadruplets. It doesn't matter. You can have 20 years of infertility and suddenly God will open the windows of heaven. And the way God has been blessing our group, God doesn't just remember you one time. God multiplies your problem and gives you double for your problems. It has happened before and it's going to happen again. But guess what? God cannot bless someone that is not present. God cannot come in the arena of blessing our women and you're not there. God cannot come in the arena when you're not making love with your partner and you're pregnant. No, God will bless you when you make love with your partner, when you exercise, when you avoid stress, when you're eating everything, when you're doing your own part. Then God will show up. Our God is a good God. Our God is not a mean God. Tell me a father that will give the kid stone or fish or snake when the son wants fish. No, a good father will be a good father, and our God is a loving father. But I'm challenging you today. Don't be the person that will stop you. Don't compare your journey with anybody's journey. If your friends are having their pregnancy test positive, if they are doing baby shower, if they're having their babies, be happy for them. Don't be sad. Don't envy them. They are not your journey. Your journey is unique. You don't know where they've been to. There are so many women we are emulating. We haven't done what they did. There are so many women we are celebrating their stories in this group. They went to different places and they did the right things. Have you done the same thing? Do you need to go for IVF? Are you still dilly-dallying? Are you still looking for excuses? So many people are talking about money. I understand that. Then what are we going to do when money becomes the problem? Are we going to say, oh, we are not going to start a family because of money? No. No. Our babies are bigger than money. Our babies are bigger than money. Believe me. If you have to borrow money, go and borrow. If you have to sell your property, go and sell. There are so many ways you can overcome. Stop leaning on your understanding. I'm challenging you today. I dare you to do something different. I dare you to go and look for that money. I dare you to go for that IVF. I dare you to go for that donor egg, that donor sperm, that adoption. And you watch and see. Do you know the beautiful thing about taking that bold step, that leap of faith? When God opens your womb, it's express. When God gives you babies, it's express. Most adopted babies are open doors. So many families that had long extended infertility, by the time they adopted babies, babies began to come. Do you know why? No baby is born to be single. Every singular baby deserves a sibling. So don't tell me about your excuses. I'm not bullied about your excuses. I want to know what we can do about it. We cannot control whether we are going to be challenged, but we can control how we are going to be, follow the challenge. Infertility is temporal. It's not going to last. So get up. Let's go again. Let's energize ourselves. Let's go back to the drawing board. Let's remember the promises of God. Let's go beyond wishing and start doing. Your ovulation is not clear, slightly brown. There is no such thing, my sister. You don't see ovulation. This is the misconception. If you don't have the right knowledge, my people, you will keep making the same mistake. You don't see ovulation. No. What you are likely mistaking for ovulation is cervical mucus. It's just a non-specific sign. Stop wasting time asking the same question. They are not going to give you solutions. Go and seek help. This is what you need. Okay? So thank you for coming. Let me quickly go up. And if we don't have any other outstanding question, then please go back. I want all our babies to be intact. I want all the women that will have their positive pregnancy test to have their positive pregnancy test. This lady is still asking questions. Your foster child is ready to give you her eggs. My sister, you keep missing the point. You don't just go and take another person and say this person will give you the egg. We need to evaluate. We need to know so many things. So donor egg and donor sperm is not based on you. It's based on set criteria that must be met. So you still don't get this. And my sister, you've been following me for years and you've been asking the same question. And I tell you what openly, it's frustrating. Believe me, it's very, very frustrating. I expect this type of question from someone new. Okay? So please do the right things. Okay, guys, I believe we've come to the end of today's event. And it's the last broadcast for the month of July. I want you to wake up tomorrow, August 1st, renew your commitment, renew your zeal, start naming your babies. If you haven't named your babies, name them, call them names, count your blessings. Remember, in everything, give thanks. So count your blessings. It's okay. If you haven't become a mother, it's okay. You're going to become. But don't dwell in, spirit of not being thankful. Be thankful. Be expectant. Name your babies. Decorate their rooms. Make provisions for them. Call their names. You will become. Nothing can stop you. Thank you for coming. Before I end, I just want to make one of you recommendation. Stop your ovulation sex. Stop time sex. Stop fertility window sex. We recommend you make love 48 hourly. Making love frequently will ensure you have adequate live sperm in the vagina. When you have live sperm in the vagina, it can get you pregnant 5 days beyond the period it was deposited. This is what you need to do. Go and do your own part. Let God do his own part. I want to see you celebrate too. So many of you love babies' pictures, testimonies. You claim is your portion. You've been speaking positivity. What about action? How are you going to do it? The lady that went for surrogacy, that had 3 babies, and you're going to claim her babies, are you going to do the surrogacy she did? Are you going to do her IVF? What is preventing you from doing what you need to do? Do you understand that God is the decider of how we are going to be parents? If God says you're going to be a mother through IVF and you're binding and casting IVF, how are you going to become? Are you God? You didn't keep your life. You didn't wake yourself up today. You're going to see August. And if God kept you alive, God has a reason for keeping you alive. So I want us to change the ways we approach all these things, okay? So thank you so much. And this time around, I'm going to go up again. I'm just trying to give everybody equal opportunity before I go. And hopefully we don't have any other outstanding questions. So I'm going to go up one more time. Okay? Make sure you subscribe. Move from your asking question zone. Come in for 1 week. We have provision. The reason why we structured our subscription for different packages is to allow other people. We understand the economy is hard. But my people, if you have plan, you can raise the money you need. There are little things we spend money on which doesn't matter, which we can save and we can get what we want. You can come in at 1 week. 1 week can change your life. You can come in at 1 month. 1 month can change your life. You can come in at 3 months. There is no way you can come in this group and you become the same. Because every single thing you need is provided. Okay? All right. Okay, so thank you for coming. We appreciate you. And my prayer is that by this time, the next time we hear from you will be that you're pregnant and you start counting down to join our group of women that will become pregnant and mothers in 2022. Now, before I go, I'm going to ask a very simple, faithful question. How many women are going to be in SGHS Mother 2022 version? If you are ready, if you are determined to become a mother in 2022, it's going to take you 9 months. I want you to type. I want you to type for me. SGHS Mother 2022. Name your babies. Let me repeat again. Type for me right now. SGHS Mother 2022 version. In bracket, type the names of your babies. If you are believing God for twins, I want you to type the names of your twins. If you're believing God for triplets, I want you to type the names of your triplets. At the bracket, SGHS Mother 2022 version, bracket, Olu and Benga, SGHS Mother 2022, in bracket, Emma and Emma, SGHS Mother 2022 version, Rebecca and Rachel, whatever you want, put it in bracket. If you're believing for 4, if you're believing for 3, if it's 2, if it's 1, whatever it is, this is the moment you've been waiting for. I might not look like your regular pastor, but guess what? Since 2015, listen to me carefully. Whenever I proclaim, it happens and more. So let's go back to doing things godly way. Let's remember that God made us mother, God made us father, God promised us, God didn't bring us this far to disappoint us. So I want to challenge you now to put in brackets SGHS Mother 2022 version, and you put the names of your babies. Correct. If you already have your babies, let me use myself an example. I have 2 babies. I have 2. They are no longer babies, actually. They are all grown-ups. They're actually the people making noise. If you hear the noise from the background, it's the Meja and Zara. Now, for me, Dr. Chudi Ufondu, proud father of Chizara Ufondu, proud father of Chudumeje Ufondu, and proud husband to Chinyere Ufondu. Now, this is me. Okay? This is me. This is my family. This is what God gave me. It wasn't an easy journey. We've been there. We've had so many ups and downs, but this is my family. This is what I'm living for. This is what I'm showing up for. If God can do it for me, God can do it for you. So put in bracket. I can see my admin, proud mother of 3 boys, Ebuka, Dubem, and Dumi. I want everybody in attendance and COO, including you. Everybody put the names of your babies in bracket. This is the last month of this month, and God will be God, and nothing can stop us. Okay, so guys, let's quickly do that so we can go for the day. Okay, so Tukwasi Chukwuobi and Nedinso, Alexandro and Andrea, keep putting the names in bracket. SGHS Mother. Remember to put a mother. If you're a father, SGHS Father 2022 version. Then put the names of your babies in bracket, and we're going to seal it, and we're going to drop it in God's feet, and God will do exactly what God says he will do. Nothing can stop God from blessing you. Absolutely nothing. You can go and mark today. Today is the last day of July 2021, and we are going to become exactly the way God said we're going to become. Okay? Miracle and faith. Keep putting those names. Farin, Omode, Milade, Farida, and Oluwa, Dimpe. That's quadruplex for you. 4 babies. God has done it before. God is not bullied. Look, God gave a Malian in Morocco 9 babies, 5 girls and 4 boys in this 2021. Are you kidding me? In Africa, not even in America. So don't think that God doesn't listen. God is a good God. God is going to do it. Okay? So guys, in next 5 minutes, I'm going to close this loop. This is a faithful journey. This is a faithful journey. Don't ever query God. Oma, Dobi, Ugo, and Obi. Please keep putting the names of your babies in bracket. Remember to specifically, proud SGHS mother 2022 version. Then put the names of your babies in bracket. If you already have your babies, what's all this? If you already have your babies right now, please include them. Mothers and fathers are not just for now, they are to come. It's called faith. So let's quickly wrap this up in next 5 minutes. Then we can all go and have some rest. Okay? Be specific about what you're asking from God. Be very, very specific. So many people show up, doctor, I don't have a boy. Doctor, I don't have a girl. God is the giver of everything good. If God proposed to give you girls, take your girls. Like my admin, she has 3 boys. Love on your boys. If God gave you girls, love on your girls. If you are so bothered you don't have a boy and a girl, there are so many babies and motherless babies. You better go and start adopting them because they are babies too. Okay? So let's quickly wrap this up and we can go and get some rest. Purity, Happiness, and David. Olami Likan, Cecilia, and Olami Posi. Sorry if I'm not pronouncing it correctly. Forgive me. Tena and Musho Ongado, boy and girl. It's going to happen. It's happened before. It will continue to happen. Keziah, Azaria, and Ephraim. Keep saying it. Keep saying it. When you go to your big mirror, write the names of your babies boldly. Put them where you can see them every single day. Let them be the reminder of what you're going to become in 2022. And here's the beautiful thing. When God gives you a baby, God gives you provisions. God gives you the wherewithal. God gives you the money to raise the baby. So you're not just going to be a mother. You're going to be a mother. You're going to be a father. And you will have the resources to raise your kids. This is what God will do. This is what God has done in the past. And God will continue to do that. Emeka and Ebuka. So I'm going to wrap up now. Thank you for coming. God bless you. Keep on believing. Keep on praying. Keep on playing. Keep on practicing. Don't give up until you become a mother, until you become a father. Thank you for coming. I appreciate you guys and enjoy the rest of your weekend. God bless you. And what's the meaning of SGHS? Snowspirations Global Health Solutions. That's the name of this group. So if you're just attending for the first time, make sure you follow admin and complete your registration process. And if you need help, please come forward. And thank you for coming. I'm going to go this time. God bless you. And admin, thank you so much. Enjoy the rest of your evening and bye-bye for now.